Morning. I had a filling fall out of a tooth, so I ended up going to the dentist. And a little trepidation there because, you're exposing yourself to a bunch of other people in a new situation that we haven't been to before. So I went, and I was remarkably surprised. And I want to tell you about my visit because I thought it went pretty much perfectly, and it might give you some insight of what to expect or maybe to want to have when you go to the dentist. So I put on my mask and gloves, and I went in, and at the glass doors going into the waiting room, there was a sign on there already that said, only patients. If you brought somebody with you, have them go out in the car. So that's good. It reduces the number of people that are going to be in the waiting room. So I go into the waiting room, and there's about 12-15 chairs there, but 3/4 of them are marked off with a ribbon and a nice little sign that says thank you for not sitting in this seat. So in the whole waiting room, there's maybe, instead of 16 chairs, there's maybe 4 that are available to sit on. So I thought, well, that also reduces the number of people that are going to be in close contact in the room. So I went over to the receptionist desk. She was behind her glass window. They were opened up about 2 inches. And she checked me in, and then I leaned forward, and she brought a temperature thing up and took my temperature, 97. So, good. She said, have a seat. So I had a seat. So I'm feeling pretty relieved at this time. This dentist office had also sent out a letter about 2 or 3 weeks ago saying that they were going to come back online and that these were the things that they were going to do in order to ensure our safety. So I had a little preamble of what was going to go on, but when I got there, everything was fitting what the letter had said. So I sat there waiting, and pretty soon they called my name. The young lady came out to get me, and she was masked up and had on, like a uniform type of thing. So I thought, good on that. We went back into the exam room. Very clean, kind of sparse. There wasn't a lot of, there are no magazines, no books, nothing that are going to hold any virus or anything involved there. So I sit down, and she took my blood pressure and asked how things were, and everything. And then she handed me a small cup that had an ounce of peroxide in it, a 1% peroxide solution. And I was asked to swish that around in my mouth, and they timed me 30 seconds, and then got rid of the wash in the cup. So that was, I think, to eliminate a little bit of potential virus that might be in my mouth, because that is their concern. This is a two-way street. Anytime you interact with anybody, you are just as much of a potential threat to them as they are to you. So it behooves us to be aware of that and to try to assure people that we are acting in a responsible manner. So that went okay. Then I noticed that the lights they have up above, they all have a piece of like sticky vinyl on the handles and the buttons to push, so that instead of having to probably disinfect that equipment, they could just pull those sticky things off, put new sticky things on, because anytime they touch those are the 2 areas they touch. So a fair amount of efficiency in there. So she decided to take an x-ray for me, and they've got that thing they put in your mouth. Well, that's all coated with a plastic, one-time use film. Goes inside my mouth. They take the x-ray. She brings the lead apron around me, and that closes up right around my chin and close to my mouth. So I'm a little bit concerned with that, and did talk to her, and I talked to her ahead of time. And I said, I'm not trying to be rude or question your practices, but I'm of a high-risk group, and there are certain things that are important to me, and I hope you don't mind me asking questions. She was very upfront, very happy to do so. So I said, I would assume that these lead vests are sterilized between patients. And she says, absolutely. They had little hangers on the wall that they hang it up and opens up, and then I think it's very easy for them to either wipe it or to spray it for the next person. So all of that's looking pretty good. And so I have removed my mask and gloves at this time. I put them in my pockets rather than have them out on their cabinets somewhere. The dentist comes in, very nice young lady, and she has on the mask and is gowned up, appropriately. On the wall are boxes of, disposable gloves. At the time they're going to start the procedure, they both go to the wall, grab their gloves, and put them on, which I like to see those items being put on in my presence, because somebody could put them on in the morning and not take them off till the night and go who knows where with them and touching everything. So at that moment, they're clean in the clean room. Only 2 people in the room there with me. They put a object in my mouth that is called a dry shield. And the dry shield is almost like a floor mat, it seems, a plastic floor mat that goes in there, surrounds my tooth, and it comes over to a little vacuum hose. And the deal with that is they turn this vacuum on, and then anything they splash or anything they drill out or chip out or whatever is just automatically removed from that area. As they start their procedure, they also put on face masks that cover, clear face masks that cover them from the bottom up, because they're looking down at you. The ones we normally see are top down. These are bottom up. Again, a very good procedure. The dry shield, very good for not aerosoling, and if you're the next person coming into the room, you don't want there to be aerosol in there from some other person who's had a procedure done. So very, very hygienic and comforting to me. So they proceed with the procedure, do a great job, no problems with it, get the tooth filled, and they complete their procedures, and I just get up, put on my mask and my gloves. I stop by their disinfector and disinfect my gloves and whatever, go out to the front room, pay my bill, and then leave. And all in all, that was exactly correct. And what I hope you gain from this is a little idea of I'm pretty picky, and I'm in a high-risk group, and my wife is, so I have to be careful, and I'm a veterinarian, and I know where the points of contact are, and this facility did a marvelous job, and I was quite pleased with it. So I hope that you can gain a little bit of information from this, so that if you go to the dentist, you could call ahead even and ask, what am I to expect at your office? What are your new normal procedures? How do you want me to come in? Some places, they'll come out and get you out of your car. They don't even have you in the waiting room, which is great. So everybody responds a little differently, but you can ask and assure yourself ahead of time, and then feel a little more confident. And if something doesn't sound right to you, or they don't care, maybe look at a different place to go to that fulfills those wishes. So, learned that yesterday, wanted to impart it to you today. Some good knowledge to have, so hope that helps you out. Have a good day.